Hello, and welcome to the JASN podcast. My name is Josie Briggs, and I'm the editor-in-chief of the journal. I am joined today by one of our editorial fellows, Dr. Magdalene Assimon. She's a research assistant professor at the University of North Carolina at Chapel Hill. Her research program focuses on evaluating medication safety and effectiveness among individuals with kidney disease, and she has a special interest in the dialysis population. She has shepherded along the paper that we're going to talk about today. We are excited to have what should be a very interesting discussion between Dr. Assimon and the study authors, Dr. Pablo Garcia, who's a nephrology fellow at Stanford, and Dr. Shuchi Anand, who's an assistant professor of medicine at Stanford. They will discuss their recent JASN paper, which is titled SARS-CoV-2 Vaccine Acceptability in Patients on Hemodialysis, a nationwide survey. So let me turn the mic over to Dr. Assimon to get us started.
Thank you, Dr. Briggs, for the kind introduction, and thank you to Doctors Garcia and Anand for joining us. In today's podcast, we'll be discussing a very relevant topic, COVID-19 vaccine acceptability and hesitancy among individuals undergoing maintenance hemodialysis. So to start off, Dr. Anand, can you set the stage for our listeners and give us an overview of the motivating factors that prompted your group to conduct this study and kind of highlight what its main objectives were?
Yeah, so thank you so much for having us, Magdalene and Dr. Briggs. So we planned this study to elicit vaccine acceptability in our patients on dialysis. We were actually very concerned that there would be high rates of vaccine hesitancy in our group because general population data that had been coming out from Pew Research or from the Kaiser Family Foundation were all highlighting that groups that were racial or ethnic minorities, people with other forms of social disadvantage, like lower income levels, or people without a college degree were expressing high rates of concerns about the vaccines and potentially would not opt to take one even after data had come out from Pfizer and Moderna indicating that they had a very effective vaccine. So we were really concerned that some of these groups are overrepresented in our population and that our population would potentially express a high degree of vaccine hesitancy as well. And so we wanted to elicit that so that we could help our partner, who is U.S. Renal Care, and other dialysis organizations prepare programming that could be directed towards increasing vaccine uptake.
All right. Thank you so much, Dr. Anand. Now I'm going to just summarize the study a little bit and then talk to Dr. Garcia about study design. So from January 8th to February 11th of this year, you offered a survey to adults undergoing hemodialysis at 150 randomly selected U.S. Renal Care dialysis facilities located across the United States to gain an understanding of patients' views on COVID-19 vaccines. Dr. Garcia, can you give us a brief overview of the methods you used to design the survey and highlight the topic areas that the survey covered?
Yes, Dr. Assimon, this is a very good question. And we designed the survey with 28 questions, and we had 4 major subheadings in the survey. One was COVID-19 and vaccines. The other one was COVID-19 effects. The other one was responder health and family structure and demographic data. We obtained this or decided to use this subheading following the conceptual framework recommended by the Strategic Advisory Group of experts working on vaccine hesitancy. It was we also decided to use the demographic questions on the basis on the U.S. U.S. Census and National Health and Nutrition Examination Survey. We created the surveys in English and in Spanish as well. And we use a software that is called Qualtrics, and we set some flyers in each dialysis unit, and each flyer had a QR code, so the patient were able to gain access to the survey using this QR code. We also, in collaboration with U.S. Renal Care staff, we used the the technology that they have available there. They have tablets, and we were able to set a link in each of the tablets, and the patients were able to respond to the survey while they were in the dialysis facility using the tablets or their own devices.
All right, thanks. I think it's great that you brought the survey right to the patient and used tablets or QR codes for them to scan on their smartphones to take the vaccine. I think it's really a great way to just go directly to the patient, and the dialysis facility is a great way to capture an active audience to get the survey completed. So moving on, Dr. Anand, can you summarize the findings of your study for our listeners? Specifically, what are the 3 most important takeaways that everyone should be aware of?
Yeah, so I think surprisingly and happily for us, we found that 80% of patients on dialysis were willing to accept a vaccine, a COVID-19 vaccine. And so that we thought was great news. That was much higher than what the general population results were at the time. Also, we found that the people who expressed higher hesitancy sort of overlapped with what was being seen in the general population. So women, people who self-identified as Black or Native American or Pacific Islander, people with lower education were more likely expressing vaccine hesitancy. But overall, the fact that 80% of our patient population was willing to get the vaccine was fantastic news. And the other sort of interesting part of this is that we asked people who were uncertain why they expressed uncertainty. And unlike the general population, when there was a lot of mistrust of the COVID-19 as a true phenomenon or the vaccine as potentially a conspiracy, our patient population seemed to recognize that this was a serious threat. Most of them were concerned mainly about the vaccine efficacy or side effects, rather than about, whether COVID-19 was truly a real phenomenon or not. So we thought that was important as well. And then the last, and I think the overarching finding is just this is a proof of concept that we can really go to our patients in real time, ask them important questions, and elicit their perspective. In this survey, which was electronically administered, we still got people who were over 80 to participate, and people who were, because Dr. Garcia, was able to translate the survey in Spanish, we got like 25% of our respondents were Hispanic. And so we got a population that was representative of the U.S. dialysis population when we reached out. And so I think that's fantastic. That's something that we can replicate for other work where we are trying to elicit our patients' opinions or perspectives on important matters. So that was, I think, the major takeaway for me as well.
All right, great. Thank you so much, Dr. Anand. And I completely agree that bringing any sort of patient-centeredness to research we do is really important. So I'll shift over and kind of go back to Dr. Garcia. So as with any clinical research study, it's important to acknowledge and discuss study limitations. One limitation mentioned in your paper was the low survey response rate. Of the over 10,000 eligible patients, only 14% responded. So Dr. Garcia, do you have a sense of what factors drove this relatively low response rate?
Yes. I would like to say that this is usually not a typical response rate to surveys sent out, but there were probably ways that we could have improved. We conducted this survey from January to February. We wanted to make sure that we share our findings as soon as possible, and perhaps more time would have been helpful to reach more patients. We also found that many of the patients tended to use the facility available tablets, and maybe having more tablets available for the patients will have been an important factor to increase the number of responses.
That's important information for future work, and I'll just let Dr. Anand chime in if she has anything else to add in.
No, I was going to just preface to say that, in the way the pandemic helped, because the facilities improved their availability of some of these electronic equipment to allow telehealth, and we were able to tap into that to allow our patients to, answer the survey. And the social workers in the facilities were key partners for us as well, which is great.
All right, thanks. We'll get towards wrapping up the podcast. So back to Dr. Anand, the COVID-19 vaccine rollout here in the U.S. has been going on for the last 6 or 7 months. Currently, we have a pretty good understanding of the side effect profiles of the various COVID-19 vaccines. In addition, there is some population-specific efficacy data that's starting to emerge. There has been a couple of recent observational studies demonstrating that most patients on hemodialysis, or some patients, develop a substantial humoral response to the mRNA vaccines. Dr. Anand, given the findings of your study related to patient concerns about vaccine side effects and vaccine efficacy, do you think this recent data has the potential to mitigate COVID-19 vaccine hesitancy among individuals undergoing hemodialysis?
Yeah, I think this is a great question, Magdalene. And I think, let's first sort of address the vaccine effectiveness question. There is a concern, and we shouldn't sort of let up on that concern, that there might be lower efficacy and effectiveness of COVID-19 vaccines in patients on dialysis. Historical data on hepatitis B and the influenza vaccines, where we've actually seen higher deaths during the influenza season despite vaccination in our patient population, just seem to point to sort of a risk for impaired responses. And the current data that are emerging are mixed. One of our studies, we are finding that there is lower humoral response than what you would have expected for the general population. So, and then, the harder question is clinical effectiveness. And part of the reason that it's tough to answer right now is because COVID-19 rates have thankfully declined significantly in the United States, at least. But that's a topic of inquiry that should continue, and it should inform how we implement PPE in our facilities, or how we implement isolation and mitigation strategies in our facilities. But for an individual person that I'm counseling in the unit, the bottom line is that they are more likely than not to have a response, and that they would be better protected from COVID-19 if they had a vaccine than if they didn't, right? So that's something that I definitely stress in my conversations with patients. I'm not sure how much of that, so I think the major concern that I get and that we got in the survey has been around side effects. And as patients are seeing more of their peers getting vaccinated and more of the general population getting vaccinated, and overall, everyone doing well with minimal to, mostly symptoms that are self-limited, that hopefully patients are feeling more comfortable getting the vaccine now. And hopefully that, positive circle of, as people get vaccinated, more people are convinced that it's safe, will continue. And we'll get close to 100% uptake in our patient population. And that's really critical, given that our patient population is so vulnerable to COVID-19. They have a mortality estimate of over 20% if they're to get seriously ill. So, it's really critical that we get as many of our patients to take the vaccine as possible.
Great. Thank you so much. And then to wrap up, last question is going to go to Dr. Garcia. Can you highlight any work that your group has planned as a follow-up to this study?
Yes. So we are now working on real-world data, and we want to understand and we want to know what are the acceptability rates among patients on dialysis in the real world. And we are right now in the process of getting this information out. And hopefully this is going to guide us and is going to help us to better understand the populations who are hesitant to get to a vaccine, and what are the social demographic characteristics of these persons as well.
All right. Dr. Anand, do you have anything to add to that?
Yeah, I think we are working with partners like Satellite and U.S. Renal, and what we are finding is that, people who are racial or ethnic minorities or people who are younger are more likely declining the vaccine in the real world. Now that vaccines have been offered to everyone, we're sort of looking at who's declining, and it's that population, and it's people living more in the South. And so I know that the programming that the dialysis organizations are doing are around peer-to-peer counseling, and I think that's hopefully going to be highly effective because patients will get to hear from people of their ilk in their language and understand the importance of the vaccine for them, and hopefully that'll increase uptake. But that's sort of the area of concern is dialysis units in areas in the south of the U.S. There is lower uptake, and that's also reflective of what's happening for the general population. And what many of the facilities and organizations are doing is more peer-to-peer programming, and hopefully that'll increase uptake.
Wonderful. Thanks so much. And we'll look forward to kind of learning from those results as well as a good follow-up to your study that's going to be published in JASN. I would like to thank both Drs. Garcia and Dr. Anand for their time, and I'll turn the mic back over to Dr. Briggs.
Well, thank you, Dr. Assimon, Dr. Garcia, and Dr. Anand for a really great discussion and for such important work. I think this will be of value to our listeners, many of whom are directly talking with patients, and the insights that you have developed in this study and subsequent work, I think, will be of great value. We all hope the optimism that we all have for an end to the pandemic is justified, but the vaccine uptake continues to be an important issue to protect us all from a possible resurgence. So such an important topic. Thank you for your superb work.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.